Welcome to the All Things Endurance podcast. I'm your host, Rick Prince, and I'm excited to have on the podcast today Dr. Nick Tiller. Dr. Tiller has a PhD in applied physiology. He's currently a research associate at the Lundquist Institute at Harbor UCLA Medical Center. He is also the author of Skeptic's Guide to Sports Science, and his research specializes in exercise physiology with a specialization in extreme exercise, that's sort of the core of what we're talking about today. So, Nick, welcome to the podcast.
Pleasure to be here. Thanks for the invitation.
Yeah, of course. So, for our listeners, I had met Nick over the last 2 years when we did our conference. Was introduced to him through our ultra running contributor, Jason Koop, and for the last two conferences, all the feedback has been, well, especially after the first one, you got to bring Nick back. You got to bring Nick back for the second conference. So he knows his stuff, good stuff, and I'm looking forward to this podcast. So Nick, I honestly did a little bit of an intro about you, but if you could maybe tell us a little bit more about yourself, maybe also as well as your athletic background, things of that nature.
Yeah, of course. Well, as you alluded to, I come from a kinesiology background. In the UK and Europe, it's more commonly known as sports science. And I decided that I wanted to specialize in exercise physiology. That was my calling, so to speak, because I just remember going to classes when I was an undergraduate student, and anybody who's really fallen in love with a subject will have a similar experience. But I just remember going to classes and thinking, I can't believe that I actually get to study this, on a day-to-day basis. And I can, people all around the world study all different subjects, and I get to study something that I'm so passionate about, learning about the body's wonderfully complex responses to different external stimuli. And I knew that there was no going back for me. I was very fortunate to work on the UK Olympic program for a couple of years. So I was able to apply my trade at the highest level, working with athletes and coaches who were training and preparing for the Olympics. And then it was at that point, this was about 2010, that I realized that as much as I loved the sport, I was more in love with the science. And as you know better than anyone, when you are working in applied sport, when you're actually working performance sport, the science isn't always as strong as it could be. Everything is performance focused rather than being science focused, and you can't always apply both with sort of 100% vehemence, if you like. And I really knew that I wanted to focus on the science. So I went and did my PhD in West London at Brunel University, focusing on applied physiology with a specialism in respiratory. And during this time, I was getting more and more involved in running. I'd been running marathons since about 2001, and around 2008, 2009, I ran my first ultra, got into Ironman as well. And so I've been doing that for about a decade and a half, over a decade and a half. And I guess the last 6 or 7 years, I've had the unique privilege to be able to combine my personal passion for ultra marathon and ultra endurance sport with my professional work. And I've actually been doing research, applied research, and writing papers to improve our understanding of the physiology, the pathophysiology of ultra endurance sport, sex differences in the sport as well. And it gives me the wonderful opportunity to come on podcasts like this and talk about something that I am genuinely very passionate about.
Oh, that's great. That's great. Before we got on this podcast, I know that we sort of wanted to put a little bit of a disclaimer out there for our listeners as far as some of the stuff that we'll be talking about today. If you just wanted to briefly speak to that.
Yeah, absolutely. It's just that because obviously we're going to be talking about not just physiological responses, but when in some instances training and particularly racing might not have positive effects on the body. We're actually going to talk about some of the pathophysiology associated with extreme exercise. It's called extreme for a reason. And
Mhm.
so it's important just to let people know that we're going to be talking in broad brushstrokes. We're going to be talking very broadly. If I talk about a particular study, that means that it applies to most people. Or if I talk about a scientific consensus, it means that scientists and practitioners are generally agreed on a topic. That doesn't mean it necessarily applies to you, because everybody is different. Everybody has individual responses to training and racing. So it's important just to keep that in mind. So we are going to be talking pretty generally about what the research shows and what the science of endurance sport shows and the direction that it points us, but that everybody's different and everybody responds differently. Everybody will have different adaptations. So I just wanted to make that very clear.
Yeah, thank you, Nick. That's important. So maybe we'll just kind of get right into the meat of it here. Certainly at USCO, we see certain trends happening, and one of the trends is that endurance sports is definitely trending towards longer distances, whether that be cycling, triathlon with Ironman, and especially running. I mean, the sort of the rise of ultra running is just incredible. So I guess to put it bluntly, is this a good thing from a health perspective? It used to be endurance sports was anything, and it still is, a mile to 5K to 10K, whatever people want to define endurance sports as. But it seems recently that everything's been kind of almost shifted away from the intensity side and more towards the endurance side. So just wonder if you could talk about that and with respect to the health ramifications and the health perspective of that shift.
Yes, so it's really important right off the bat to try and distinguish between training and racing, because generally speaking, training, regardless of the distance that you're training for, tends to have overwhelmingly positive effects on the body. Whereas racing, again, depending on the distance, we can sort of nobody thinks that going out and running for 24, 48 hours or longer in a particular ultra trail race is good for you. And I don't think anybody's kidding themselves into thinking. I mean, you just look at the physical and psychological condition that you're in when you stumble over the line and you haven't slept for 2 days and you're malnourished and dehydrated and you've got acute kidney injury and you can't feel your legs. I mean, I've been there. I've done 100-mile trail races. I know what it feels like. Nobody thinks that that's good for you. Whereas the training aspect, you can pretty much train for any distance and it will only have positive effects on the body. So if you look at studies, for example, that try and unpick what if there's a minimum dose and a maximum dose in terms of the cardiovascular benefits, and we see a pretty clear trend. So for example, if you were to do just 50% of the recommended physical activity guidelines, so you're going out and you're doing a, a, a slow walk for 20 minutes a day, that's pretty much sedentary, right? Then going out and doing something, just going out and doing 20 minutes of easy walking a day is better than doing nothing. It's better than just
Sure.
being completely sedentary. If you can only go out and manage one slow plodding jog, for 45 minutes around your local park, if you can only do that once a week, you're still going to get a benefit. It's not going to be a big benefit, but you're still going to get some positive cardiovascular adaptation. If you can double it, you'll pretty much there's going to be a beneficial dose response. So in terms of your cardiovascular benefit, doubling that amount of exercise will double the benefits, and you can pretty much draw a straight line up to about. And again, there have been some pretty large epidemiological studies that have looked at this. You'll pretty much get a linear dose response for cardiovascular benefits up to between 6 and 8 hours a week. So if you put that in practical terms, if you were to go out and run a slow 10K 5-6 days a week, that will probably give you the optimum cardiovascular adaptations. Again, everyone's different. So some people, if they have some kind of underlying condition, that might be enough to cause them some harm. And, they might have to go and clear this with their GP. But for most people, they're going to be able to do that and they're going to get the optimum response. And that would be enough for most people to go out and train for a marathon, or even a lot of people. If you look at the average weekly mileage for your typical ultra runner, they're only running between 60 and 80 kilometers a week. It's not very much. Of course, the elite runners are running more, and if you want to run a better time in your race, you need to do a higher mileage. But you can pretty much go out and train for marathon and ultra marathon and only get positive responses. But once you go out and you're periodically racing and you're running, 4, 5, 6 marathons a year, or you're going out and you're running 100-miler every other month, that's when it's associated with some kind of maladaptation, a negative response on the body. It doesn't mean that the disadvantages become. It's not that the risk benefit ratio changes considerably. It's still going to have a net beneficial effect, but it's not going to be all good. You get diminishing returns once you go out and you start racing marathons and ultra marathons. So definitely it's important to distinguish between between training and racing.
Yeah, that's a great point. So the way how you phrased that, it sounds kind of like you said, if you do even just a slow walk or a slow jog, that's better than nothing. And then the kind of hits that tipping point. So would you say then the health benefits of exercise largely function on a bell curve for the most part?
Yeah, I think so. So again, certainly in terms of training, you could certainly plot something of a bell curve, but I guess it would almost be a bell curve that's cut off halfway.
Yeah.
Uh,
Okay.
so so in terms of the beneficial effects, yes, you'll get some effects with just going out and doing something. If you can increase your exercise volume, you're only going to get positive responses up to a certain point, and then the you'll get no further benefit. Once you start go out and start doing these races, that's when the problems come in. I mean, if you look at the lifespan of a typical Olympic athlete, for example, then sorry, I've got. I assume we're not live.
No.
Oh, okay, good. I've got this hand waving thing. If I put my hands up, but I'm getting
Okay.
these weird emojis coming up. Let me just see if I can turn that off. Sorry, Rick.
Yeah. No. Take your time.
Okay, I'll just try not to use my hands too much.
Okay.
Yeah, I think it's I think I've got a box check that like if I put my thumbs up or something, or uh it's like an AI assistant. Okay, I'll just try not to use my
Oh,
hands.
funny.
Okay, so do you want to leave me in with that again?
Uh, yeah. So yeah, if we want to, we'll just kind of talk about that whole thing. So based off what you were saying earlier, it sounds like, obviously if you do no exercise, not a good thing. If you go out there and do, five ultra marathons a month, not a good thing, probably from a health perspective. So it sounds like this largely exists on a bell curve. Would you say that as far as the volume of exercise as it pertains to health, we'll call it?
Yeah, I think that's a pretty good way to characterize it. So doing something is better than nothing. The disadvantages of being completely sedentary are very well documented. Long periods of sitting, independent risk factor for cardiovascular disease, and you're much more likely to suffer cardiovascular disease or some other kind of early mortality if you're completely sedentary and you do nothing. You get some benefit from doing something. It doesn't matter what it is, even if it's just one moderate intensity exercise session a week. You get benefits the more that you do up to a certain point. Once you start racing for the longer distance stuff. So for some people, it would be half marathons, marathons, and certainly ultra marathons. It's definitely associated with diminishing returns. That's not to say that the benefits won't outweigh the negatives, or the positives won't outweigh the negatives, because for most people it will. But that's when it's associated with diminishing returns. We have to be a little bit more mindful about how often we're racing, and the specific types of races that we choose, and the period in between them, to make sure that you're recovering properly, because it's obviously much harder to do those kinds of races periodically.
Yeah, absolutely. Training, I feel like, is often viewed almost solely through the perspective of human performance, getting faster, getting stronger, being able to go further. And what I've personally found, it's rarely done through the lens of health. It's like it's one of my buddies said, I said I was doing some cardio. He said, that's when you're on the decline, when you start calling it cardio, not training, And I feel
Mm.
like, so many people view training just from a performance benefit. So as you sort of noted, how are these two things often at odds with each other from a health and a training perspective? I guess with regard to how we're speaking of it, it's largely a volume-based thing. Once you hit that tipping point, then is that correct?
Yeah, for sure. I mean, if you look at any of the large studies that have looked at the performance determinants of marathons and ultra marathons, ultra endurance sport, weekly mileage is one of the biggest drivers. So the more miles that you can do, the higher your training volume, the better your performance will be. Again, up to a point. For some people, they'll reach a tipping point and they'll get injured, or they'll pick up some kind of infection because they're not recovering properly and their immune system is suffering. But for most people, the more miles you can do, the better. Now, of course, you can look at that both ways, because it could just be that people who are able to, who are less predisposed to injury, are able to do more miles, or maybe they just have more leisure time. They're able to cover a higher weekly mileage, and so maybe that's why they're able to perform better. So it's not necessarily causal, but from a physiological perspective, it makes sense that high volume training triggers the types of adaptations that we need in terms of improving your ability to mobilize and burn fats, training your muscle fatigability, or your ability to withstand fatigue or to delay and prolong fatigue. That's really important. That comes with high mileage training. Running economy is another really important part of endurance performance. So all of these things are typically trained with slow, steady running, which is why most people have traditionally adopted like an 80-20 approach, where they're doing like 80% of their training time is like high volume. So that makes sense from a physical perspective. To answer your question in terms of whether there's like a trade-off between health and performance, I think there often is, because, and particularly in the ultra endurance sport, that if you ask people, um, would you stop training and racing in the sport if you found out that it was no good for you? If you found out unequivocally that training and racing in ultra endurance sport actually had negative effects on your health, would you stop doing it? And 75% of people say no, because they care
Yeah.
too much about the sport, they care about the performance. There's obviously a social aspect to it as well. So I think people definitely prioritize their performance over their health, but it doesn't have to be a false dichotomy. You can train for something looking at performance if you're mindful about how you train and about training smart and your recovery. You can maximize longevity in the sport as well. But I think the most important thing is that people, it's difficult to get people to take this advice on, but it's the best thing to do is focus on it whether you enjoy it. Don't worry about whether it's benefiting your health. Try not to focus too much on performance. If you enjoy something, then you're more likely to keep doing it. You'll spend more time doing it. The performance will come if the more you dedicate to it and the more you train, and the health benefits will come if you enjoy it. And again, this has been widely studied. If you don't enjoy something, you're not going to keep doing it. You won't adhere to it, and then the health benefits go out the window. So I think getting people to focus on doing something that they enjoy and that they love, that should come first. And then the performance and the health, they will come as a byproduct of that.
Yeah. Yeah. No, that's a great point. I think it's an angle that a lot of people don't take as far as the enjoyment factor. I mean, I would imagine that in order to train and do one of these ultra marathons, you sort of have to enjoy it. But it's funny, for so long, it was the bucket list was always marathon. People would just do a marathon from nothing, or maybe they do a 5K first. And now it's sort of jumped up to that ultra marathon. We hear that a lot here at USCA, like, oh, I've never really done anything, but I want to train for a 100 miler. So it's kind of interesting how things have sort of pivoted to that distance, that long distance perspective. Um, Going back to the bell curve thing, I think it's important because, you know, endurance athletes, so many of them are kind of type A, right? And more is better. If this much is good for me, then doing a ton of it's got to be even that much better. And would you say that might be one reason also that people, maybe because, maybe that's why people gravitate towards these ultra endurance events, but why they just keep doing it and pushing and pushing and pushing, because they maybe falsely assume that if they just do more of this exercise, it's even better for them.
I certainly think that's true, but I also think that a minority of people are doing this type of exercise because they think that it's good for them. I don't think most people start doing ultra marathons for the health benefits.
Hmm.
I think most people are drawn to this sport because they want to push themselves physically and mentally to their limits. I know that that's true for me. That's why I started running ultra, essentially because I've been running marathon for all these years, found that I'd hit an upper limit in terms of how fast I could run, because I'm not genetically predisposed to be able to. I will never run a 2:30 marathon. I will never run a 2:45 marathon. I think if I really dedicated myself, I'm probably a little bit too old now. I could probably run a high 250s, close to 3 hour marathon. But I always knew that was a genetic limit for me. I just didn't have the physiology. So I decided to challenge myself by running the distances. And I think that's the draw for most people. And particularly with ultra marathon, with ultra endurance sport in general, there are so many different races, so many different distances in terms of you could run a 50K on the road, 50K in the mountains, you can run across the desert, you can run a 160K, you can do stage races. These races are contested in the snow, in the desert, in the mountains, in the heat, you name it. There's so much variety here. So many different race types, race structures, and I think that's something that people can go out and explore. And if you, like you say, people are drawn to this sport if they're type A personalities, they want to test themselves. And ultra marathon is just the ultimate proving ground. And you can go on testing yourself. Just because you can go out and run a hard 50 mile mountain race, it doesn't mean you can necessarily run 100 miles or in any of these other conditions. So it's very much addictive in that respect. And is also a from a sort of a psychopathology perspective, it is an addictive sport. A lot of people come into ultra marathon as a way as a way of replacing other addictions in the life. Often they're ex-drug users, they're ex-alcoholics, and they've come into this sport in their sort of middle age, late 30s, early 40s, and they rightly assume that replacing their previous addiction with extreme endurance exercise, it's okay, they're replacing it with another addiction, but generally speaking, training for this kind of sport is healthful. It is good for the body.
Sure.
So yeah, it does attract a certain type of person, and it's certainly a way to push yourself to your physical and mental limits. And that's a double-edged sword. On the one hand, it gives you enormous self-confidence. You learn a lot about yourself, and a great sense of achievement when you enter a race that you don't know if you can actually finish. You don't know that if you can survive this thing, and you've never done it before, and you train for it, you dedicate yourself to it, and you accomplish that goal. It's very, very addictive. But at the same time, if you do these types of races too often, as we've alluded to, there can be negative physical effects on the body. But I don't think anybody's entering these types of races or starting this kind of sport because they think it's physically good for them. I think there are many other things that you can do just for the health benefits.
Yeah, for sure. Um, so maybe if we could just touch on this briefly, you've mentioned several times some of the negative physical effects of doing, multiple long distance ultras, in relatively close proximity. What are some of those negative health benefits that someone might encounter by doing that?
Well, the most common ones are cardiovascular related. So when we talk about the cardiovascular system, we're talking about the heart and the blood vessels specifically. And the cardiovascular system is obviously the main engine, if you like. It's responsible for transporting oxygen around the body. When you're exercising for long periods of time, the muscles, oxygen and nutrient demands go up. So the cardiovascular strain increases. And of course, your cardiovascular system is ticking along. It's doing its job 24 hours a day, 7 days a week. But then you go out and you're contesting a 100-mile race, and it takes you 24 hours, 48 hours, depending on the race. The good runners at UTMB, for example, often take 30 hours or more to complete the race. So there's an enormous amount of cardiovascular strain or stress. And so if you look at studies that have done cardiovascular assessments, cardiovascular tests, cardiac ultrasounds, for example, they have shown that lifelong marathon and ultra marathon runners, so people that have been doing this for 20, 30 years, are more likely to have something called myocardial fibrosis, which is literally scarring of the cardiac tissue. Just in the same way that if you are exercising your muscles every single day, often you build up scar tissue in the muscle and you get aches and pains. The muscles might become stiff. You might get kind of fibrous injuries. That is the exact same kind of maladaptation in the heart, because the heart is striated muscle. It's sort of organized along with the same kind of structure as the skeletal muscle. And so if you're putting the heart under that kind of strain, then it can be associated with myocardial fibrosis in extreme cases. And obviously, fibrotic scarring of the heart makes the heart a slightly less efficient pump. So this is obviously not a favorable adaptation. So that's sort of an example of one of the things that can happen. Atrial arrhythmias, is another example of one of the maladaptations that can occur. So people might have irregular heart rhythms, regular heartbeats, which may or may not be associated with symptoms. Again, this won't happen with everybody, but for some people will be more susceptible. And there's also a risk of acute kidney injury as well. So if you go out and you run any given ultramarathon, you don't even have to run for days on end. It's not just the most extreme races. But any time where you get considerable muscle damage and dehydration, you're putting the kidneys under a lot of strain, because the kidneys and the renal system more broadly has to filter out all of the metabolic byproducts from energy metabolism. When the muscles break down, they're leaking proteins called myoglobin into the blood. This is associated with rhabdomyolysis. But even if you're not having overt rhabdo, which is where your pee turns red because of the myoglobin pigment, this can still strain the kidneys. And it's often made worse when people, for example, start taking NSAIDs, non-steroid anti-inflammatory drugs during the races. So it's not uncommon to have an acute kidney injury at the end of the race. Now, in most people, it's a mild kidney injury. They probably wouldn't even know that they had it, and
Mm.
it recovers within a few days or a week. But if you're doing that 4, 5, 6 times a year, every year for 10, 20 years, then it's more than plausible that that might be associated with long-term adaptations, so long-term kidney injury. We don't really have enough data to say that's definitely happening and how to avoid it, but it's certainly plausible. And then, of course, you have the interaction between the kidney, between the renal system and the cardiovascular system. None of these body systems work in isolation. So if you overstress one system, it's going to have a downstream effect on the other. This is called the cardio-renal axis. So by and large, the negative effects, if there are any, they're usually going to be isolated to the cardiovascular and renal system and the interaction between the two. The respiratory system is more or less okay in terms of uh, being robust enough to sustain the rigors of training and racing. Uh, Not necessarily true if you're an asthmatic, then obviously you need to be a little bit more mindful of your respiratory system and your musculoskeletal system. Well, everybody knows that if you're not careful, you'll pick up an injury. But injuries can be avoided if you're smart with your training and if you have sufficient recovery and that kind of thing. So yeah, it's mostly the cardio-renal axis that is most affected by ultra racing.
Got it. I remember reading a while back about left ventricular hypertrophy. Is that a more of a genetic thing as far as issues with that are concerned, or is that also a training maladaptation to just doing way too much, just volume over very, very long periods of time?
Yeah, good question. And it's important to distinguish between the type of left ventricular hypertrophy or LVH that you would get if somebody were obese, for example,
Hmm.
compared to somebody who's training consistently, which we call it the athlete's heart. So somebody who's very, very overweight and is carrying around a lot of excess body mass. We have to remember that body fat is it's a live tissue. It requires its own blood supply, so it can put enormous strain on the heart because you have this little heart that's having to supply blood to this large body mass, and that puts a lot of strain on the heart. So the heart actually becomes weaker. It becomes a less efficient pump, and it becomes enlarged as a result. But it's actually a less efficient pump. Now, the athlete's heart is something slightly different. This is generally seen as a relatively normal response to training and a favorable response. It's mostly localized to the left side of the heart, as you said, left ventricular hypertrophy. So it's the left ventricle, and it becomes bigger and stronger because just like if you were to go to a gym and you do squats, your legs would generally get bigger and stronger. You do lots of bicep curls, your biceps going to grow because
Not mine,
you're
but
well, yeah, I don't know. I've seen you in a
try that.
t-shirt.
Doesn't work. Sorry, go
But
ahead.
the general principles, and the heart is the same thing. If you put more stress on the heart, you demand more of the heart. And every day you're going out and you're running for 45 minutes or 60 minutes, the left side of the heart will become bigger and stronger, so that with each contraction, with each systole, it can pump more blood out of the heart. So your stroke volume goes up, your cardiac output goes up, your heart becomes a more efficient pump. So generally, that's seen as a beneficial response to training, and it's and it's not and it's relatively benign. It's only a problem if, like I said, you start developing scar tissue in the heart because of the extreme endurance exercise, or if your training volume is very, very high, if you're racing too frequently, or if you have some kind of heart valve dysfunction, but that's a lot rarer.
Got it. Got it. No, I appreciate that clarification. Um, one of the other things we
And
see
it's almost,
here,
and if I
yeah,
can just, before you move on, it's almost like
yeah,
a badge of honor, actually, because like if any endurance athlete who's gone and had like an echocardiogram, for example, I had quite a lot of them when I was studying sports science in London, for practical exams and for people's research projects and things. So I would have an echocardiogram or another scan of the heart, and they would always find that I had a very large left ventricle and a really nice big ascending aorta, and I always wore that as a badge of honor. I was always very proud of that, and while there's nothing wrong with that necessarily, it can, um, if you let that go too far, actually, it can have downstream implications because a lot of people, some people are quite excited to tell you that they had rhabdo, for example. Oh yeah,
right.
I trained so hard or I raced so hard that my pee turned red, and they don't necessarily realize the potentially serious implications of that. So I think bravado and pride, something about pride coming before a fall. Yeah, something like that. Um, so I think that's something to be mindful of. But yeah, the athlete's heart, left ventricular hypertrophy is part and parcel of the sport.
Gotcha. Gotcha. You had mentioned the 80/20, training principle a little bit earlier. Do you feel, and this is more of just a subjective question, I suppose, versus something that's, data driven. Do you find that most ultra runners or people in these ultra sports, whether it be Ironman or, Tour de France type riders, do you think they over prioritize the low intensity, high volume versus intensity training, whether it be, tempo, VO2 max type workouts? And should these ultra endurance athletes be maybe taking a little bit off the endurance and adding a little more intensity? Again, more of just a subjective question, but just want to kind of get your thoughts on that.
Yeah, it's a very difficult question to answer because different individuals, different athletes and coaches have different perspectives on this,
Sure.
and and also different things will work best for different people.
Right.
Certainly for endurance sports, when you're getting up to sports that last for 2, 3, 4 and more hours, the volume is the most important aspect because, as I said earlier, the types of physiological adaptations that you're trying to evoke tend to come from long duration exercise. So your ability to burn fat, so your metabolic flexibility, your economy, so how efficient you are with your oxygen use, your ability to shuttle lactate and recycle lactate. Lactate is a very important energy source for the body. It's not a waste product and it doesn't cause fatigue like a lot of people think. But lactate is actually a very important energy source. But it's only useful as an energy source if you can shuttle it away from the muscle where it's produced and you can oxidize it or you can recycle it. So and that is a mechanism or a system that is mostly trained. I wouldn't say at low intensity, but it's certainly not, sprint interval pace. It's
Yeah.
more likely to be tempo or threshold, and training muscle fatigability, and also training for the for ultra endurance sport. It's I don't think it's controversial to say that it's more of a psychological challenge than it is a physical one, and so training the psychological resilience and robustness that the ability to go out and run for 12 hours, 24 hours, 48 hours, or days on end. That's something that um, it's nature and nurture, of course, but that's something that you have to condition yourself to be able to do. And not everyone can do that, even if they've got the physical capacity. And you can say that the same about marathon. And so most of these adaptations come from high volume training. Now, I think some intensity is important, but if you think about how we train VO2 max, so VO2 max is the maximum volume of oxygen that we can take in and utilize in a minute of maximal exercise. It's one of the main determinants of marathon running, for example. It's less important once we get to ultra marathon and ultra endurance. Still a factor, it's still a predictor of performance, but it's relatively less of a predictor. It's not as powerful as a predictor. And so as an elite athlete, if they wanted to improve their VO2 max, they would have to train intervals, 2, 3 times a week at least, and they'd have to work at super physiological speeds. You know, you're looking at 120% of their VO2 max, of the speed associated with VO2 max. That's once you're an elite athlete and your VO2 max is already very high. Just to keep it up there is extremely difficult. To improve it once it gets, into the 60, late high 60s, low 70s, it's extremely difficult to maintain that level of VO2 max or to increase it. So it's sometimes diminishing returns. As we age as well, you get a natural age-related decline in VO2 max. And I wrote about this recently for Ultra Running Magazine. And
Mm.
it's this idea that, look, you're gonna suffer age-related declines in VO2 max. You can't really do much about that. You get roughly a 2% decline in VO2 max every year after about the age of 30, 35. Now, that doesn't tend to be as important for ultra runners because most ultra runners are in their late 30s, 40s, 50s, for example. You get relatively fewer ultra runners in their 20s and younger. And because VO2 max is not a key determinant of performance, that doesn't tend to bother us. But you have to sort of ask the question, well, is it worth working really, really hard and maybe training 2, 3 times a week, doing intervals and increasing my risk of injury as a result, because it's the high
Yeah.
intensity stuff and the speed intervals. That's where you're more likely to get injured acutely. If you're going to be suffering these age-related declines anyway, or is it a better idea to actually use that time and put it into a different session and work on your running economy or your lactate threshold, these things that are still maneuverable? You can still improve your running economy and your lactate threshold and your muscle endurance long into middle-aged and older age, whereas VO2 max, that's going to come down anyway.
Yeah.
So
Yeah.
it's sort of it's about being strategic with where you invest your resources and just and acknowledging what's most important for you
Yeah.
as for your age and for the level that you're racing at.
Yeah, yeah, that makes sense. So, I mean, I guess to sum all that up is for any of ultra athletes listening, aside from doing sort of the zone two sort of lower intensity stuff, high volume is maybe like you said, focus on focus on their lactate threshold, get that increasing, and maybe not so much on the high end, the VO2 max type stuff.
Yeah, well, I mean, as a coach, you tell me where if you're working with an athlete who is, maybe in their 40s and they're training for marathons or ultra marathons, what kind of advice do you normally give them in terms of splitting their time between low volume kind of steady state stuff and more high intensity intervals? How do
Yeah.
you approach that?
Yeah, I mean, similar to what you just said, I think, I mean, certainly, as you noted, the VO2 max is the ceiling, and you can't go past that. It's what it is. So I would say if it's quite low, work on that, just but primarily for the purpose so that they can increase their lactate threshold to a higher level. But certainly the majority would be, to your point, endurance and LT sort of threshold type stuff for sure. So and obviously
Yeah.
that rings especially true for any type of ultra type distance.
Yeah, and it depends on their level as well, because somebody who's new to the sport and who hasn't doesn't have a great deal of experience in running, they can go out and they can do relatively high volume, low intensity running, and they'll improve their VO2 max just by
Yes.
virtue of the fact that they're stressing the cardiovascular system. They don't need to do high intensity intervals. Once they get, as I said, once they get to the higher levels, and they become a more seasoned athlete, then you have to start doing more high intensity stuff
Yeah.
to further push your VO2 max. But somebody who's relatively new to the game, they're going to get these increases in VO2 max anyway. And I think it's funny what you talked about, the ceiling effect, because some people are just naturally will have a high VO2 max.
Yeah.
Some people who've never trained before will have a naturally high VO2 max, and it's frustrating, but that's the reality. I mean, when I was at university, again, we used to do all these physical tests on each other, and my VO2 max was, and I was doing a lot of running at the time. It was like 62 or something, and I was quite pleased with that. But I always wanted to run faster. I wanted to run faster marathons and be a better triathlete. And my lecturer at the time, Peter Jones, so shout out to Dr. Jones if you're listening. He said to me, "Well, look, Nick, you've got to be honest. You're never going to have a VO2 max of 75, are you?" He's talking about mils per kilogram per minute. You're never going to have a VO2 max of 75. So you've got to, make the best with what you've got. And I always remembered that. And I thought, right, I'm going to show him. And this is me when I was in my sort of early 20s. I was doing my degree and then my master's. And I started training more and I upped my volume and I was doing two threshold sessions a week. I was doing intervals. I was doing lots of track work and I was working really, really hard. And then about 8 months later, I took another VO2 max test and I worked so hard. I was so focused and my VO2 max was 64. And and it's never got even close to 75. And he was absolutely right.
Yeah.
Because he knew in his experience that I just didn't have the genetics. I didn't have
Yeah.
the physiological makeup to have a VO2 max of 75. Most people don't.
Yeah.
You have to be born with the genetics of an elite athlete to have a VO2 max of 75. So you make do with what you've got and train and race accordingly.
Yeah, yeah, it's the choosing good parents is a big factor of
Right,
performance,
absolutely.
right?
Yeah.
Um, so last question for you, Nick. So, we discussed sort of what that toxic level of exercise may be, and we've spoken about it with respect to the cardiovascular system. Um, you know, Training programs incorporate so many things, cardiovascular, strength, all these kind of things. Is there any, I guess looking at it from the culmination of all these different training adaptations, is there a culmination effect when it comes to toxic? So let's say I'm doing, I don't know, 10 hours of running a week, but I'm also doing 4 hours in the gym and I'm also doing Pilates and yoga and, who knows what else. Or is it more just sort of from a cardiovascular aspect that we're talking about from a toxic level of exercise?
Yeah, so again, it's important to distinguish between training and racing. So, I mean, there have been studies looking at the the physical health and the lifespan of people who are quote unquote extreme exercisers. So these are not elite athletes who are training 2 or 3 times a day, but they're doing, and again, the authors refer to it as extreme exercise. So they're going out and they're doing at least an hour or 2 hours of exercise every day. So for most people, that is extreme. For an ultra runner, that's normal. But
Yeah.
we have to remember that actually for the rest of the population, that is considered extreme. And and they had no greater risk of cardiovascular disease. They had no greater risk of early mortality. And again, if you look at Olympic athletes, at retired Olympians, or even they've looked at similar studies on the first cohort of people to break the 4 minute mile. So Roger Bannister and his contemporaries. And they tend to live slightly longer than people in the general population because their careers exercise training for training and competing in sport, and also they're just generally healthier lifestyles as well. So even after they retire, they continue to be physically active, and so they live on average, 5, 6 years longer than people in the general population. And so I don't think there's anything uh, wrong with going out and doing so-called extreme exercise. So you might be going out and training twice a day. You'll know if you're doing too much because your body will start complaining at you. You'll start picking up
Mm,
frequent injuries. You'll start picking up frequent infections because your immune system is suffering. You'll feel tired and lethargic. Maybe you've got some kind of nutrient deficiency because you're not eating properly. If you're progressively losing weight, then that tells you that you're burning more calories than you're taking in, which, if you do that in the long term, then again, that can have implications on immune function and your ability to recover from training. So there's a fine balance there, but your body will generally tell you if you're doing too much. The problem with when it comes to racing is that, again, there is no amount of racing that is good for you. When it comes to marathons and ultra marathons, there's nothing. People will try and argue that, while we were designed for this and we've evolved for this, we haven't evolved to go out and redline our running velocity for 3, 4, 5 hours in a marathon. We haven't evolved to go and run up a mountain for the best part of 2 days. That's not normal, and that's okay. But what it means is that we have to do it mindfully. So be aware of the risks, stay informed of all the research and on the physiology and the pathophysiology. Don't pretend those risks don't exist. That doesn't help anyone. So stay informed, assess the risks and discuss the risks with your with your significant other or your family, your coach, your physician. Again, don't pretend those risks don't exist and bury your head in the sand. That doesn't help anyone. But you can have an open conversation with your coach and your physician about, okay, what are the risks and benefits of competing periodically in ultra endurance, and then modify your program and your training accordingly. So if we can, I think we can all agree that going out and doing a 100 miler once a month is probably too much. That's not going to have a positive outcome on the body. So think about, okay, what races do you really want to do? When in the year are they going to crop up? How can you train for them and taper for them and recover from them fully,
Hmm.
so that you can get the most from the race and you can minimize the risks and maximize the benefits? Because all of sport, especially when you get to the extreme stuff, is about balancing the um, the risks and the benefits. And it's always a trade-off between those two things. And you can only do that if you're mindful of them, if you're cognitive about it, use your intellect, not just your intuition, have open discussions. And then you can, like I say, you can maximize the benefits, maximize your performance, maximize your enjoyment and your longevity, but at the same time, minimize the inevitable risks.
Yeah, yeah. I love what you mentioned about, listen to your body, be attentive if you see certain things popping up, like getting injured, a lot of fatigue, weight dropping, using that because as you noted, everyone responds to exercise differently, kind of using that as a benchmark. Okay, I might be pushing things too far, I think is super, super valuable and important. Um, well, thank you so much, Nick. This has been great. I know there's a lot of topics that you are certainly well versed in. So hopefully we can do this again on maybe another topic, maybe environmental stuff or something. It's always great chatting with you.
Absolutely. Thank you for the invitation. That was a lot of fun. Thanks, Rick.
Great. Thank you very much, Nick.